this meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes so that the citizenry may be aware of the time, place, and agenda of this meeting. Roll call sheet, did that go around?
Yes.
I missed it. Okay, thank you. Everybody here? Missing one. Okay, we need a motion to approve today's agenda.
Motion to approve. Second.
We have a motion and a second. All in favor say aye.
Aye.
Those opposed? Looking for a motion to approve the minutes from our previous meeting.
Also move.
We have a motion. Do we have a second?
I'll second.
Motion and a second. All in favor say aye.
Aye.
Those opposed? Okay. Doesn't look like we have any public. Brings us down to program presentation.
All right, I've got a little bit of an echo here, so hang on.
Thank you.
So our program presentation this morning is our immunization program. And we have a couple of our nurses here to provide the presentation. We have our nursing supervisor, Sarah Roan, and our newest nurse, Kira, is here. So they're gonna provide a little bit of an overview of our immunization program. I'll get the PowerPoint started.
And we do have a UWG RN to BSN student with us, Tatum.
Hi.
All right, well, thanks for having us today. We're gonna give you an overview of our immunization program, which Kira has been whipping into shape really well for us. We had a DNP student too, or intern, I should say, that was really kind of helping us just organize everything to a T. And so, yeah. Tell you a little bit about it here. So the VFC program, actually, what is our immunization program? So we actually take appointments. We used to have walk-in Wednesday, like during COVID, but we have very few and far between people that come in. So to have somebody readily available to give a vaccine, 5 days a week was getting more and more challenging. So we went to by appointment only. Obviously, we try to get them in as soon as we can. Sometimes it can be the same day, but it can be that week. We are also at Compassionate Connections up in Clintonville once a month. And we actually did 8 vaccinations up there the last month we were up there. So a large Hispanic community too is up there. So we always have an interpreter on site up there. So we have the VFC program, which is vaccines for children, and reports and activities to reinforce adequate vaccine rates. We're actually going to get into that a little bit later. Kira's going to share some of that information with Child Care Annual Survey, the school annual survey, and then childhood reminder letters, which she's in the process of working on right now. And then we're going to tell you a little bit more about outbreak preparation and mass clinics. And then I just wanted to share, so we had a grant for immunizations, which was some leftover COVID funds. We got a new temperature monitoring system, we got backpacks, and then we got vaccination books. So we can pass these around. There's actually one in Spanish. So we can give these out at events, and it's kind of just giving more information about vaccines, especially being able to talk to your kids about them, why they're important. And I just think they're kind of fun, so I wanted to share that with you. Then we have our BFA program, which is vaccines for adults. And then we also, with that, have an adult program outreach where we typically do jail vaccinations. We've been on hold because of being short-staffed for a few months, but we will eventually get back into the jail to give vaccines. Over there, they usually just have a sign-up sheet that they want vaccines, and then we look up in the Wisconsin Immunization Registry to see if they're due. I will say if 15 people sign up, we're probably giving vaccines to 2, but they're just trying to get out of their pod to be by somebody. So that's why we got smart and started asking for their names earlier so we could look their records up so they're not in line, and then we look them up, we're like, oh, thanks for coming, but you don't need anything today. So next. So then our Vaccines for Children program, and you'll see our numbers in a couple slides from now, but there was a change in that this year. So we used to be able to serve underserved for insurance for the VFC program. Now we can only serve those who are uninsured. So I mean, if somebody, let's say HPV vaccine was not covered, we could give them the HPV vaccine if their insurance didn't cover it. That is not the case anymore. So I unfortunately think our vaccination rates are gonna go down more, but hopefully they're getting them elsewhere because they do have insurance. So that's one of the first questions we ask is, do you have insurance? And a lot of people are used to saying, yeah, but this one's not covered. And we're like, unfortunately, that was a change in the program just a few months ago, actually. And so that just kind of lists the vaccines that are covered, so majority of them for the Vaccines for Children program. And then those who have health insurance that, again, they don't really cover them, there are some options for them, which is the Noble Health Clinic in Wautoma, and then there's a Theta Care in Clintonville. So we do have options that we can send them to if, their insurance doesn't cover them. So then the vaccine, next slide, please. The Vaccine for Adult program, that we can serve ages 19 and older, and that we can serve underserved and uninsured. So that one did not change. There's sometimes different vaccines that they will just say, like for instance, I haven't heard it yet for the measles vaccine, but at one point in time, the Tdap we could give to anybody because there was a huge outbreak in pertussis. They actually just pulled that this year too and made it just part of the VFC and VFA program versus being able to give it to anybody. So a lot of times we have questions to get that vaccine, and now we're starting to have to say unless you're eligible, we can't get it. So things change actually in the vaccine world quite a bit actually. Next slide, please. So here you'll look back in 2022 where we have the VFC and the VFA vaccines, but you can see that the VFA vaccines are in the 4,000s. And so that was the first big year of the COVID vaccines. In fact, there was one day we gave over 500 vaccines at the Masonic Center. So, but then we can look at the far end, 2025, our numbers are very low at this point in time. And like I said, we're almost halfway through the year and I don't anticipate them getting real high. Sometimes when we do mass clinics and schools, that helps us raise the numbers for like flu vaccines. But like I said, next year, you'll probably see in the annual report that vaccines were a lot lower this year than in previous years for multiple reasons.
So one thing that I actually learned about coming to Waupaca that I didn't have to do in Washera is the child care annual survey. So according to state statute, child care centers are required to keep immunization records or the waiver records for all those that attend that are between the ages of 2 and 4. And for the waiver records, generally they have to say, is it a medical reason, personal reason, or religious? And then for that age group, they have to keep track of the DTaP, polio, HIV, pneumococcal conjugate, and hepatitis B. And generally, we'll get a reminder beginning of April to kind of reach out to childcare centers, see if they have responded to the survey, and if they haven't, we send reminders to them saying, hey, this is coming due at the end of the month. You are required to submit to the survey. And then we just have a tracker that we write down if they've responded, if they haven't, and who we need to reach out to. And this year we actually had 28 childcare centers in our county. All but one responded to the survey, but that one actually was temporarily closed. Next slide. And our school annual survey, this is usually done around the 40th day of school. And what I actually did this year was get all of the school calendars that are available on their website so that come October, when they get the school nurses get reminders, I can reach out and also remind them as we're getting close to the deadline. I think this year it's very, very close to the end of October when the survey would be due. But this is kindergarten through 7th grade. They look at the polio, hepatitis B, tetanus, diphtheria, pertussis. There's different variations that would qualify. Varicella, MMR, Tdap, and then meningitis. And then entry into 12th grade is the second dose of the meningitis that's listed there.
And then I just wanted to share that we have been trying to make arrangements to reach out more to the Amish community. We were actually trying to partner with Wisconsin Literacy because they were doing a project with trying to unite all the Amish communities across Wisconsin so that they had more people to talk to. And I guess the biggest thing is just to be informational to them. And actually, Wisconsin Literacy had made plain language for our vaccine information sheets, just so it's more simple terms for them to understand. And that way, for instance, if we happen to get measles, which we'll talk about later in this community, that way they can be informed. And if there's somebody who's maybe immunocompromised, they might think a little bit more about getting them vaccinated for something like that. So we want to try to form those relationships, and we'll continue to try to think of ideas of how we can do that so that they can also feel comfortable coming to us with questions on things or even more than just immunizations.
Can I ask a question? How does the Amish community, do they accept vaccines like this? Do they?
Certain vaccines.
Yep, it depends. Tetanus, they're a big one on, but they really typically only want just tetanus, not the combination of tetanus, diphtheria, and pertussis, which is that Tdap combination. I do know that, and it was kind of well known, there was somebody in the Amish community that had passed away from pertussis. And so then, our community was a little more open to having those who were immunocompromised have the Tdap vaccine because of, a situation like that had happened, unfortunately. But tetanus, just that one alone, because working on farms and stuff, they are aware that that one's a really important one to have. So sometimes they are more open to something like that.
Yeah, there's some families too that are more open if there's some kind of outbreak to getting the vaccine that would be involved. I think even with chickenpox, that's a little more hesitant, but if it's a large enough outbreak, they may be more interested in getting it.
And our concern was, and that was our original plan, was to go try to talk with them and maybe be at their greenhouse openings. Maybe that's something we can do next year because, they interact with everybody in the community. So the community could be bringing things into them. And then just to kind of show the community that we're working with that population and then them seeing that we're willing to work with them and the community and support each other. So.
You already did it. Thank you. So as Sarah mentioned, childhood reminder letters is something that I've been recently working on. What we do is look at benchmark reports in the Wisconsin Immunization Registry. And for children that are 5 months old, 6 months, or 16 months old, and 24 months old, we look and see, are they on target with their vaccine schedule? If not, we can send reminders that are actually generated through the Wisconsin registry, letting them know, hey, you're due for all these vaccines. Here's what to expect for your child at this age. There's also information on how to look up either their child or even themselves on the Wisconsin registry. And this year we're actually adding in the public health brochure to let them know if they don't have insurance, they can come to us to get up to date on all their vaccines.
You can actually look in the Wisconsin Immunization Registry with your social security number to see what vaccines you've had or what you might be due for. So I just wanted to recognize our students and the work we do with them. And this is our, like I said, our NVSN UWGB student. So most semesters we're having between 6 and 9 UW-Oshkosh nursing students. So sometimes, scheduling can be challenging, but we want to give them the most roundabout experience that we can in public health. And a lot of that is vaccinations. Sometimes the first vaccine they give is with us. So we do just-in-time training with them and, just let them go for it. And they usually do a really good job. And then, like I shared, we did have a Concordia DNP intern as well. So that was kind of exciting because she was very intelligent and excited to be with us. And, their eyes open up going, wow, this is community health. They had no idea. So just wanted to share that. And that's our 3 students actually at Compassionate Connections last semester. Next slide. So I wanted to share for those of you who have not seen, we're pretty excited to be in our new facility. Thank you for all your support with that. So on the far left, that's exactly what you see, the rooms on the left. We do have an exam table still in there so that if somebody sometimes has a tendency to pass out or gets nervous, that they can actually lay down or just be in there to lay down afterwards as well. Doesn't get used very often, but we still want to have it readily available. And then in the middle is actually our base clinic room where we do have all of our vaccinations in the cooler, and the freezer you can't see, it's kind of right by the door behind us. But that's where we draw all of our vaccines and kind of prep so that, you know, the little kiddos aren't seeing us, you know, put the needles and everything together. And then the far right is where we're typically given the vaccines. So it looks like your standard clinic room. Try to keep it very clean and cozy. And then we like to give the books out and sometimes the backpacks then too, for kiddos that come in. Next.
So for emergency vaccinations, we do have relationships with the school nurses. They help to track all of their students' immunization status or waiver forms, kind of like what I was saying with the school annual survey. And if we would be doing like a mass flu clinic, I guess that's every other year.
We
that do
typically
that?
do it every year. We didn't jump on board this year. We don't always have a lot of buy-in from the schools. Like we did have Waupaca. We try to ask all the schools. We've done Iola, we've done Manawa, we've done Waupaca, but it's kind of catch and go whether there's buy-in or not. And then sometimes we do sign them up and then we might have low numbers. I think the high school, we did 9 students last year. So it's kind of like to put all this together. Sometimes it's worth it. Sometimes it's like, you know, they're going to their doctors to get the flu vaccine. So.
But with those relationships that we have with the school nurses, they help us get consents out to families quickly. So in an emergency situation, we could send them a template, they get it sent out. I think a lot of it is electronic at this point. If needed, we can do verbal. And then with those relationships, we can kind of coordinate with any appropriate staff that need to also participate in the mass clinic. We've also been working on an immunization program, functional exercises, which let us know like how to set up mass clinics, what supplies we need, equipment that we need, and prepares the staff for whatever roles and helps also determine how many staff members, based on the number of students that we expect to participate. We've also been working on updating policies and procedures, which help us to monitor our stock to make sure that we would be prepared for an emergency situation. So if there would be an outbreak of like measles, which we'll talk about more. And with these updated procedures, we're monitoring our supplies a little bit better too. We have a list with expiration date and eventually like how much we actually have on hand. So we know, do we have enough in case there's an emergency, or what should we have on hand to make sure we're prepared?
Who declares an emergency and what defines it?
We, you know, the county can, but the state has to declare a state of emergency for us to be able to do some of the ramp up with emergency vaccination clinics. The state and the federal government.
And the state has to wait for federal government, I think, before it can trickle down to us, and then we can make the decision to do that after the state makes that decision.
So just to add to that, so we're always prepared and we're always monitoring and ready to ramp up, depending on what's circulating, what outbreaks are going on. So obviously right now, measles has been something that's been going on. There's some outbreaks, and we'll talk more about that. Sarah touched on COVID. We ramped up for COVID. We provided over 14,000 vaccinations for COVID, just the health department. So that's one of our duties, is to be ready to prepare and to be able to respond to emergency situations. H1N1 was another one that we also did that. Every local health department did that, and there were other things, other outbreaks that the same thing that so it's something that we're providing our normal vaccinations, the VFC and VFA program, but we have to be ready to respond to for situations that come up. And so that's where we talked about too. We do functional exercises, prepare, and it does help us. And I think we're constantly training and learning and being ready to do more than just our day-to-day activities as well.
So just to kind of keep building on that, as Judge was saying, we're planning for pandemics. We do the school mass clinics, and I would say the elementary school in Waupaca, we probably have 40-some vaccinations, so that was a little bit more. And we did have all 9 students there working with us, so they got to kind of see the flow of how things work. And so when we do a functional exercise, we are playing it like we're actually in a pandemic, or we've got an outbreak of some sort going on where we have to respond. And so we do set up our incident command structure, ICS, which we all do training for. We do ICS 100, 200, and 300, and then we do NIM 700 and 800, which they are really intense courses. It's not just easy read and take your test. I mean, they're hours long to try to understand unity of command and different things like that. But this is kind of your basics that when we went over and did our tabletop exercise for measles, which we're going to talk about a little bit more later, we decided who would be incident commander if we had, a measles case and then maybe 4 measles cases and so forth. Who would we consider to be our safety officer, our PIO, public information officer, which is, Jen, as we know, a liaison officer, operations section chief. That was actually me through the pandemic. And, I had to make sure that we had staff adequate for each, mass clinic that we had. And then all the supplies and stuff that go with it as well. And then all the training, for the people that had never worked with us before. And then we have a planning section chief, logistics section chief, and then finance section chief. So those are kind of your basics that we have when we operate with an incident command structure. So that kind of prepared us. COVID years, that's actually my daughter up there. We had a drive-through flu clinic at the fairgrounds. So that was interesting. We were in full PPE, and I just kind of wanted to share here and at the Masonic Center. This is Mary Ellie. Some of you may know. She was one of our retired nurses. So when the pandemic happened, we actually hired 19 contract and LTE staff. And that's on top of the 9 students that we had. So there was a lot of people to make sure we're scheduled adequately and monitor and make sure they had the appropriate training and stuff too. Obviously, Mary was an expert coming back. We didn't have to do any training with her, but that was kind of a neat situation. Next. So then this is the Masonic Center. So as I was saying, we brought back retired staff as well. And so in the middle, bless her, Sue Comfort had come back. She's no longer with us, but she was a sweetheart to come and help us. And then the gentleman actually at the far right runs the Masonic Center, and he brought his mother in, which was very kind as well. And then on the far left is, that planning piece that we have in logistics is where, everybody had to be 6 feet apart. So how are we going to get everybody lined up in here, to maintain 6 feet apart, which was, the guidelines we had to follow. Like we'd have axes on the floor, and we had to make sure that the flow was good. I think we changed the flow 2 or 3 times because it just, this isn't working, and we'd see crowds kind of coming together. So then we'd get more separating bars set up so that people could be congregating together. There was a few times that we had lines outside, like going in the parking lot, and then that's logistics of there's ice outside, how are we going to keep track to make sure nobody's falling, those types of things as well. So any questions about our immunization programs?
What percent of non-vaccinators do you have, like waivers going through the schools?
We actually have, this is my measles book that I take everywhere with me, but I do have a slip in here if you wanted me to try to find it and give it to you. But I mean, I would say it's between 87 and 99 for schools. So we do keep track of that to kind of monitor like which schools would be more concerned about, to have more of an outbreak situation. We have had varicella in the past with, schools that have high waiver rates. And unfortunately, when those situations happen, it's usually we ask for guidance from the state, but we can exclude children for the 21 days that they might come down with symptoms. And that gets really challenging because if there's siblings in the household and maybe a different classroom and then they're re-exposed, that 21 days could turn into 42 days. And it gets very, very challenging. And, at that point in time, families, if that's the choice we make, families have the option to either go get their first vaccination and then they can go back to school the next day, or they're going to maybe be excluded. So it's unfortunate, but that's just, the guidelines we have to follow to protect the rest of the people in the community and in the schools.
I think we do have actually lower vaccination rates than the state average.
I want to say 87 total around that. So.
Any other questions?
Thank you.
Yeah, we've got more. Jen's gonna.
brings us up to the general board business, measles update.
Yeah, so we thought we'd provide a measles update. That's, something that's been going on for the last several months. Obviously in Texas and New Mexico, they've had a larger outbreak. And really this year, we can go through the slides too. So measles was actually declared eliminated in the US back in 2000. I'd say, I don't know, Sarah can maybe confirm this, I'd say maybe the last 5 or 10 years, we're starting to see a little bit more pockets of measles coming back with some smaller outbreaks. This year in particular has been different. Just when you compare years on numbers of cases, much different. I think we have that in another slide. But just want to kind of give you an update on the state of the current outbreaks in the US, and we've kind of talked a little bit about the things that we do to prepare. If we haven't had a case in Wisconsin yet. I can say if we had a case in the state, we'd certainly be getting quite a bit of information to prepare. And if we ever had a case in the county, it'd be we start our incident command and start preparing to respond to that.
As you can see, Wisconsin is surrounded by cases in the
Yep.
states around us, so that's why we're like just kind of waiting. And when the NFL draft happened, we thought in the next 21 days, but so far so good.
So just a little bit of information on the vaccine to start out with here. You have your routine 2 doses for childhood vaccination series, and then your 1 dose for MMR. 1 dose of MMR is one of the more effective vaccines. It's 93% effective. You get 2 and it's 97%. So a very effective vaccine. A little bit more information on the outbreak. So you want to compare it to last year, 16 outbreaks, 285 confirmed cases in the US. Compared to this year, through May 15th, we're over 1,000, 31 different states, 14 different outbreaks, and then the largest again in the Texas, New Mexico area. There had been 3 confirmed deaths with the New Mexico, Texas outbreak. I believe 2 of those were children.
Those 2, I think, were in Texas.
In Texas. And 13% of the cases have been hospitalized. Do you guys want to touch a little bit on some of the possible effects from having measles? Symptoms and
I did bring, so we've got all kinds of sheets that we can share. So if you're born, this is one of the questions is, should I get a measles booster or not? Should I get vaccinated? If you're born before 1957, they're saying you're more than likely have been exposed at some point in time, so you don't need to get a vaccination. We have actually received quite a few phone calls of those that are traveling that, have been born in like 1954, and they're like, oh, what do you think? I'm like, well, I think the best thing is to talk to your provider if you're traveling to like Texas and high endemic area. But then if you're born between 1957 and 1988, they're saying you should receive at least 1 vaccination. However, there's a little extra to it. If you're born between 1963 and 1967, they said that vaccinations during those 4 years were not working. So kind of excluding those 4 years between that time period. And then if you're born after 1989, you should have 2 doses. So just kind of give some guidelines about that. And then we do have some talking points. Measles symptoms usually start 10 to 12 days to develop after exposure. And signs and symptoms are high fever, 103 to 105, so very high fever, cough, runny nose, red watery eyes, conjunctivitis, and rash. And rash usually lasts 5 to 6 days. Usually begins at the hairline, works its way down through the trunk of your body. And I think that's probably about it. We do have like a fact sheet from Department of Health Services. I don't know if we want to pass that around. So if people do have questions, we can give that to them as well. And if we would have a measles case, those are the things that we would be doing. We have guidelines through the state of things that we have to do for our interview. And then we gather like close contacts, and then we have to follow up the close contacts. And again, if they're children, we have to decide whether they potentially would be excluded, from school or daycare at that time too. So
I had a question on what's the vector? Is it coughing? Is that how it's carried? Or?
yep, airborne.
Yeah.
Droplet, obviously, if you touched it.
Yeah, well.
The rash, that would be an exposure too.
Okay.
And that's why airborne, you know, we do, which I was gonna mention a little bit on the last slide, but I'll just share it right now. So we have internal fit testing, which is what we do to make sure that our respirators are fit okay. So that if we were in an airborne situation, we wouldn't be exposed to that. So if we ever had to do mass clinics again, like we did with COVID, initially we were wearing all N95 respirators and had, you know, were fit tested for that. Eventually it was just a surgical mask, but you know, because we wanted to take the extra precaution in measles, we would have to wear an N95 respirator. So we do internal fit testing on that as well annually to make sure that everybody has the appropriate fit mask and they know how to put it on.
A little bit more information on Texas, New Mexico outbreaks, and this is all data from the CDC. So Texas has had 722 confirmed cases, 92 patients have been hospitalized, and 2 fatalities, and New Mexico 74 cases. And have some vaccination statuses there for them as well. We've talked a little bit about outbreak preparation, just a little bit more information on things that we've have to keep in mind when we're preparing for an outbreak. And we talked about we've done exercises. We've actually done an internal exercise for measles just to prepare in case, a tabletop exercise, so that we are prepared if we have a case.
And like the reassigning staff, just to share, like during COVID, we had like our Healthy Beginnings team making calls for us. We had environmental health doing things for us. So I mean, when we talk about sharing with other people, I mean, we're pulling our other units in public health and doing some quick just-in-time training of how to conduct these interviews. Because I mean, I remember one day there was over 300 cases that came into WEDS, which is our electronic disease surveillance system. And somebody has to process all those and bring them into what's jurisdiction review and assign them to people. And so that was always, you know, hours long of just processing that. So we pulled many team members in to be assigned those cases then. So, thank you.
I'm trying to say,
To have immunizations for this outbreak, who determines how much we need to have supply? Do we do that, or is it from the state?
We typically do. So I go to a quarterly regional managers meeting and we have those discussions, and then there's a NEWIC meeting too, which is the Northeast Wisconsin Immunization Coalition. And so we had these conversations that I think it was like a month ago because you had just started, and there was a little bit of a shortage of MMR. So we were trying to just strategically talk that, you know, we don't want to have an overabundance of vaccine on hand where somebody else might need it. The nice thing is when we bring it in through the Wisconsin Immunization Registry where we order it from, let's say Waupaca County needs some, we play nice in the sandbox and we're like, hey, we've got extra over here. Do you want to come get it? And we try to share. So if there's an outbreak in a certain county, other counties will pitch in and say, hey, I've got extra vaccine. So we do share it if needed.
Any other questions?
I've had a few people that haven't had, they're not in the WIR, but they say they've had all their immunizations. You used to have it written down on a little yellow card and carry it around.
If they have something from a physician, we can enter it in Wisconsin Immunization Registry as a historical record. In fact, I know we've got boxes of immunization records in our basement because we can never get rid of those. So I mean, and even when, let's say somebody comes in from Mexico, if they have something from Mexico, not just handwritten, whatever, you know, we can take that and put it in as historical records. You can run titers too. They're kind of expensive, and I don't know if Tatum had to do this, but she had her vaccination records. You're young. I had to do titers when I was going to college to see if I had varicella before, if I had measles before, because otherwise I had to get the vaccine. And they actually wanted me to do titers instead of just get the vaccine over again. And I think it was like $200 to get titers ran, but
I
that
had
is
to
an
do
option.
my titers from my Hep B. I had all 6
Okay, so
of
you
them, and it wouldn't. Yeah, they made me pay for it.
still had to do
Yep.
titers. So there are other options to see if there's immunity out there. Otherwise, like I said, we kind of go with the guidelines for like measles. You know, we've got the years of that sort of thing to follow too. So.
Anything else? Okay. So brings us to new lab fees.
So we are officially open for business for two new tests in the water lab, total phosphorus and total suspended solids. We've already taken some samples from land and water, just kind of doing some trial testing with them. But we do need to establish some rates for those two tests. And so we're just starting with $28 for total phosphorus and $21 for total suspended solids. And right now we're just basing off of those kind of where other labs have been testing or have been charging for testing. I think once we run through the test a little bit more and have an idea of exactly where all of our costs come in, we may adjust those, but this is our starting point. So we would just need some approval to have these fees established for those two tests.
Okay, so looking for a motion.
I'll make that motion.
Yeah.
I'll second.
Okay, we have a motion and a second. All in favor, say aye. Aye. Opposed? Okay, we now have some new fees. Personnel update.
Only update I have is that we're still recruiting for a part-time nurse position. That's the only open position.
Brings us to your report, Jeff.
Just to continue with some of our, some of our nursing programs. We've been really in the last few months, we've had some transitions with new nurses, and we've really been digging into our nursing programs the last few months and getting things, I think, in a really good spot. We've talked a lot about immunizations today. I think, one thing to keep in mind is it's one thing just to provide the immunization, but there's so much around this, or around that immunization that we have to train for, prepare for, have policies for. So there's just a lot of things that we have to have in order. We have fees for certain services as well. So we've been really digging into, making our programs obviously compliant, and then also as efficient as possible. So we've been really working on that. But we've also been digging into our reproductive health program. It's a very complex program. We actually, a handful of years ago, stepped back from the amount of services that we had provided in that program. We used to, in fact, get a Title 10 grant. We stepped back from that, and now we're just a dual protection reproductive health program. We do still get a grant for that program, but I will say, as we kind of peel back and in all the layers, there's a considerable amount of things that we have to have in place to provide, say, a pregnancy test. And so the nurses and I have really been digging into our policies, our programs, training, working with the state to make sure we have things in place. As we're doing this too, we're evaluating the program. Is this something that we have the capacity and ability to do? Is it a service that our community needs? So probably more to come on some of this information, but I just wanted to share that we're really working through these programs to make sure we have them as efficient as possible, as compliant as possible, and to make sure they're services that we provide to the community that they need and they want, and that we're providing the service that our health department needs to provide to your community. But like I said, there's just a lot. Some of these programs are very intensive with how much stuff we have to do. I mentioned like just provide a pregnancy test. There's so many things around that we have to have in place just to provide the test. So just giving you a heads up on some of the work that the nurses have been doing the last few months. We have some very complex programs: communicable disease, immunizations, reproductive health, lead poisoning, and we've had two nurses. We have a nurse on leave, and it's been quite a bit of work, and they've been doing a really nice job of staying on top of daily assignments and then really making sure our programs are in the right place. So just wanted to add that.
Okay, that brings us down to supervisor reports. Anybody been to any conferences or seminars or wanna get anything off your chest?
I'm going into closed session.
Our next meeting, June 25th.
Motion to adjourn.
All our business is taken care of. We have a motion to adjourn. It's non-debatable. We are adjourned.